Topography of the peritoneum. Peritoneum, it is the serous coat which covers the walls of the abdominal cavity and covers the internal organs. To begin with, let's start from the abdominal cavity walls, its borderlines. Superior border of the abdominal cavity is the diaphragm. Laterally, there are lateral abdominal muscles. Inferiorly, perineum, anteriorly, anterior abdominal muscles, behind vertebral column with muscles. Peritoneal cavity is inside the abdominal cavity. It is inserted here, like in Russian doll Matryoshka, a small doll is inserted into the large. Peritoneum covers the abdominal walls, covers the internal organs, fixes them, and gives them the mobility. We can subdivide the peritoneal cavity into three stories. The upper, superiorly is bounded by diaphragm, inferiorly by the mesocolon of the transverse colon. Middle story, it is bounded superiorly by the mesocolon of the transverse colon, inferiorly, if it is intact cadaver, it is linea bispinata, which connects two spina iliaca anterior superior. If you study the dissected body, the borderline between middle and lower story is another line. It is linea terminalis. Now let's continue to study the peritoneum on natural preparations. What we can see here? This is complex of the organs which are covered by peritoneum by different manner. It is generally believed that we have two layers of the peritoneum, parietal and visceral. Parietal covers the walls of the abdominal cavity. It reflexes to the internal organs and continues with the visceral layer. Visceral layer covers the internal organs. When parietal layer continues with the visceral, we can see some reflections. These are ligaments, or mesenteries, or amantha, or folds. Distinguish three types of covering the organs by a peritoneum. First of all, intraperitoneal, when the organ is fully invested into peritoneum. Mesoperitoneal, when only three walls are covered by peritoneum, like ascending, descending colon or liver. And third type, extraperitoneal position, when only one wall of the organ is covered by the peritoneum. Example is the pancreas. Your home task. I recommended you to fill in the table which consists of three columns. Left column, you should write out the list of the intraperitoneal organs, second meso and third extraperitoneal organs. This is your home task. Let's continue. I'll remind that upper story of the peritoneal cavity superiorly is bounded by the diaphragm and inferiorly by the transverse colon and its mesenterium. It is subdivided into three additional sacs, or bursa. There are three bursa. First of all, Borgia Hepatica. It is in the right side. It contains the right lobe of the liver. Anteriorly and to the left, there is Borgia Pregastrica. It contains the left lobe of the liver and spleen. And behind the stomach and lesser Amentum, there is bursa omentalis, or lesser sac. Now about borderlines of these bursas. Let's start from the Borgia Hepatica. Borgia Hepatica, it contains the right lobe of the liver. Its left border is ligamentum falciforme. Superiorly is parietal peritoneum covering the diaphragm. Posteriorly is the ligamentum coronarium hepatis. Anteriorly and laterally is parietal peritoneum covering the anterolateral abdominal wall. This bursa has no inferior wall. It communicates with the bursa omentalis and through bursa omentalis with the middle story. The second sac is bursa perigastrica. This bursa is separated from the bursa hepatica by the ligamentum falciforme. It is its right wall. It contains left lobe of the liver. Superiorly is parietal peritoneum covering the diaphragm. What we can see in the left side? This is spleen. It is fixed to the greater curvature of the stomach by the ligamentum gastrolienale. It contains the vessels. And here we can see ligament which fixes the spleen to the diaphragm. It is ligamentum phrenica lienale. These ligaments compose the left border of the bursa perigastrica. Posteriorly is the anterior wall of the stomach and lesa amentum. Anterior wall is parietal peritoneum which covers anterior abdominal wall. This bursa has no lower wall, and it is considered that this bursa communicates with the proper peritoneal cavity along the surface of the great amentum. Third sac is bursa amentalis or lesa sac. It is difficult to demonstrate this bursa because it is located in the depth. We can enter this bursa through the foramen epiploicum. This bursa has 6 walls. Let's start from the anterior wall. Upper part of the anterior wall is formed by the lesser amentum. Note that I am demonstrating only its outer surface, not inner surface. So, lesser amentum, it is the peritoneum which goes from the liver to the stomach and duodenum. This is ligamentum hepatoduodenale. It contains the vessels and duct, and this is hepatogastric ligament. So these ligaments form lesser amentum. Middle part is formed by posterior wall of the stomach, and lower part of anterior wall is formed by the ligamentum gastracolicum. It consists of 2 laminas of peritoneum which is stretched between the greater curvature of the stomach and colon transversum. So this is ligamentum gastracolicum. 3 components of anterior wall. Left wall. These are ligaments of the spleen. Ligamentum gastrolienale and ligamentum phrenica lienale. It is the left wall. Upper wall. It is well known lobus caudatus of the liver. When we enter the bursa omentalis through the foramen epiploicum, we can palpate this lobe, lobus caudatus of the liver, by our finger. Lower wall. Lower wall of bursa omentalis is mesocolon of transverse column, which is also lower border of the upper story of the peritoneal cavity. Right wall of bursa omentalis actually is absent. It has opening. This is foramen epiploicum. Foramen epiploicum, it has 4 walls. Superior border of foramen epiploicum. It is lobus caudatus of the liver. Inferior wall is pars superior duodenum. Anterior wall of foramen epiploicum is ligamentum hepatoduodenale. It is its internal surface. Posterior wall is parietal peritoneum covering vena cava inferior, and look at this fold. It is fold which stretches toward the right kidney, which lies behind the peritoneum, and this is ligamentum hepatorenale. It is also part of posterior wall. And finally, the posterior wall of bursa amentalis. Structures which form this wall I will show you on the model. So, posterior wall is formed by the parietal peritoneum, which covers pancreas, vena cava inferior, aorta, left suprarenal gland and left kidney, its upper pole. Middle story of the peritoneal cavity. It is bounded superiorly by mesocolon of transverse colon and colon transversum proper, inferiorly by linea bispinata or linea terminalis. This story contains some canals, sinuses and recessuses. There are two canals, canalis lateralis dexter and canalis lateralis sinister. There are two sinuses in the center, sinus mesentericus dexter and sinus mesentericus sinister. Some recessuses I will show you later. Let's start from the canals. Canalis lateralis dexter. Laterally is bounded by the parietal peritoneum covering anterior lateral abdominal wall and colon ascendens. This canal superiorly freely communicates with the upper story of the peritoneal cavity with bursa hepatica. Inferiorly, it is considered that this canal is closed by the plica retrocecalis, which prevents the spreading of pathological contents of this canal to the pelvic cavity. Canalis lateralis sinister. Superiorly, it is closed by the ligament which stretches between the flexura colli sinistra and diaphragm by ligament. Its name is ligamentum phrenica collicum. It supports the weight of the spleen and separates upper story and middle story. Another borders. Lateral borderline. It is parietal peritoneum which covers anterior lateral wall and colon descendens is medially. Inferiorly, it communicates with the pelvic cavity. How is it seen on the natural preparations? This is cecum, ascending colon, and this is the place for the canalis lateralis dexter. Look to the fold. This is plica retrocecalis, which is inferior border of the canalis lateralis dexter. Now let's pass over to the canalis lateralis sinister. It is the descending colon which continues with the sigmoid. And here we can see the fragment of the diaphragm. And what's this? This fold is ligamentum phrenica collicum, which is superior border of the canal. It separates middle and upper stories and spleen lies here. This is origination of canalis lateralis sinister. By the way, sulci paracolici are clearly seen here. Now let's speaking about the mesenterial sinuses. Mesenterium of the small intestine is on the center. Large intestine-like frame lies on the sides. What we can see here, this is sinus mesentericus dexter. It is bounded by colon ascendens, mesocolon of the transverse colon and radix mesenterium in the left side. It is triangular in shape. When we put the organs on place, we can see that the sinus it is more or less closed and communicates with only sinus mesentericus sinister. What is on the left side? We are pulling the small intestine to the right side, and what we can see here, this cavity is sinus mesentericus sinister. It is bounded by the radix mesenterium, descending colon, and transverse colon and its mesocolon. This sinus freely communicates with the lower story of the peritoneal cavity with the pelvis. There are some pouches or recessuses in the middle story. These are depressions on the walls, which are potential sites of internal herniation. These two recessuses we can see around the ileocecal junction. This depression is recessus ileocecalis inferior, and it is recessus ileocecalis superior. Another two recessuses we can see around the flexura duodenal-unionalis. It is superior duodenal recess and inferior duodenal recess. Recessus duodenalis superior and inferior correspondingly. Behind the sigmoid colon, in the radix of its mesocolon, we can see depression. It is called a recessus intersigmoidus. The last one is behind plica retrocecalis. It is recessus retrocecalis. Now let's speak about the Amantha. Lesser and greater Amentums. Amantha are the peritoneal folds which contain vessels, nerves, lymphatic elements, and fat tissue. Lesser Amentum is formed by two peritoneal layers. Greater Amentum consists of 4 layers. It hangs like an apron in front of the small intestine. It originates from tenia amentalis of the transverse colon. This is tenia amentalis. It consists of 4 peritoneal laminas. 2 of them form anterior wall and 2 another posterior. Sometimes there is cavity between them. More often this cavity obliterates. It contains a lot of fat and immune system elements. Its another name is abdominal policeman because it can wrap around organs to localize inflammation and prevent peritoneal adhesions. Lower story of the peritoneal cavity. Anatomy of male and female pelvic cavity is different. This is model of the male pelvis. Mind that this white line indicates the peritoneum, its visceral lamina, mesenterium, parietal lamina. So peritoneum descends to the pelvic cavity and covers the rectum. This is rectum. Note that upper part of rectum lies intraperitoneally. All its walls are covered by peritoneum. Middle third lies mesoperitoneally. 3 walls have peritoneum. And lower third lies extraperitoneally. 1 wall has peritoneal covering. Then peritoneum passes forward to the urinary bladder. Peritoneal covering of this organ. Empty urinary bladder lies extraperitoneally. 1 wall has peritoneal covering. When it is filled by urine, it rises and peritoneum covers 3 its walls, mesoperitoneal type of covering. Then peritoneum reflexes onto the anterior and lateral walls of the abdomen. This depression of peritoneum between rectum and urinary bladder is called excavatio rectovesicalis. This is the lowest point of the male pelvis. Topography of peritoneum in female pelvis. There are special female organs in between urinary bladder and rectum. These are 2 organs, uterus and vagina. Peritoneal covering of rectum is similar to the male. Upper part intraperitoneally, middle part mesoperitoneally, and lower part extraperitoneally. Then peritoneum descends from the rectum to the uterus and covers it mesoperitoneally. Then it goes to the urinary bladder. Remember that empty urinary bladder lies extraperitoneally. Filled urinary bladder lies mesoperitoneally. Then peritoneum goes to the anterior and lateral abdominal walls as parietal lamina. Look at these two depressions in the femoral pelvis. One of them is between rectum and uterus, another is between urinary bladder and uterus. This posterior pouch is called Douglas pouch. In Latin, it is excavatio recto uterina. This is the lowest point of femoral pelvis. Anterior pouch is located between urinary bladder and uterus. It is called excavatio vesica uterina. This is the second depression of femoral pelvis.